Well, welcome everyone. My name is Jennifer Jentzsch, and I'm a community health worker and peer support specialist here at Good Shepherd. And today we're going to just touch on some mental health topics. Information that we'll cover are mental health basics, mental illness, peer support, some statistics, teen mental health, and then we'll wrap up. I'll show some works cited and some resources. So what is mental health? Mental health is a state of mental well-being that enables people to cope with the stresses of life, realize their abilities, learn well, work well, and contribute to their communities. It is also an integral component of health and well-being and a basic human right. And it's crucial to personal, community, and social economic development. It's important to remember that even without having a mental illness, you can still improve your mental health. And ways to strengthen your mental health can include connecting with others, engaging in physical activity, helping others, getting adequate sleep, creating joy and satisfaction, eating well, taking care of your spirit, getting professional help if needed, and practicing mindfulness. This is not a complete list, obviously, and different skills will work for different people. So it's about finding the right fit for you. We have some facts here on mental illness. You can see on the right that 1 in every 5 adults lives with a mental illness, and this number is trending to be 6 quite soon. And then 1 in every 5 youth will live with a severe and persistent mental illness within their lifetime. And then 1 out of every 25 adults has a severe and persistent mental illness, which includes things such as schizophrenia, bipolar, or major depression disorder. There is no single cause for mental illnesses, but some contributors include adverse childhood experiences, for example, child abuse, sexual assault, witnessing violence, etc., ongoing chronic medical conditions, biological factors or chemical imbalances, use of alcohol or drugs, and having feelings of loneliness or isolation. And I would like to take a second to touch on the adverse childhood experiences. If you're interested in not just mental health, but mental health in general, I highly suggest familiarizing yourself with ACEs. There's a large amount of research into the effects of these events and how to offset them. Since we are in a rural population, I wanted to touch on some of the statistics that are prevalent for us. On the right, you can see we have compared large metro areas, medium, small metro areas, and not metro or non-metro areas like ourselves. And this is per capita. So the first one is people who received any mental health treatment in the last year, with large metro, non-metro, and medium small. And we would be the non-metro lighter color. So we are getting more mental health treatment, that first initial one, right? So with your PCP saying you should talk to someone or, connecting to crisis, things like that. And then on the second one, these are people who took medicine for mental health. And again, we are prescribed per capita more medicine for our mental health than the other areas, but we receive counseling or therapy at a smaller amount. So we have more official, like that initial visit, we're giving prescribed more medicines, but we are not following up as much or receiving as much counseling or therapy. One of the contributing factors to this, you can see on the left here, is that in rural areas, the 60% do not have a psychiatrist compared to almost 40 that do. And then nurse practitioners for mental illness is 80% do not, 20% do. And then with child psychiatrists, that is at 90% do not have a child psychiatrist. which can lead to some of the issues on the right side. In rural areas, it has been found that some other contributing factors include self-imposed barriers of asking for help when taught to pursue self-resilience as a virtue, lack of trust in anyone to maintain confidentiality in a small, close-knit community, fear of negative judgment from others as being incompetent or less capable, difficulty getting an appointment with limited availability of mental health professionals, time and transportation required for long-distance travel to meet with mental health professionals, unreliable, expensive, or non-existent internet services for online video or telehealth appointments, and lack of adequate health insurance coverage. One of the ways that we can combat some of these deficiencies is with peer support. So, what does a peer wellness specialist do? Which is what I am. We inspire hope that people can and do recover. We walk with others through their journeys. We dispel myths on mental health and substance use disorders. And we support others in identifying and achieving goals, hopes, and dreams. And each of these aspects looks different depending on the client and what they want to work on. Here we have core values and peer support. So peer support is voluntary, it's mutual and reciprocal. We have equally shared power. It's strength-focused, transparent, and person-driven. And peer supporters are people who are hopeful, open-minded, empathetic, respectful. They're facilitators of change, and they're honest and direct. And actually, when going through these slides with my husband, I mentioned that I didn't like this slide, and I made it. And I said, I don't like this slide because these are often used as buzzwords with really no meaning behind them. Like, oh yeah, it's voluntary, right? Or it's mutual. So I just wanted to touch on this real quick and say that if you'd like to know more about these or how they are used in practice for peer support, please feel free to reach out. Okay, so what has peer support been shown to do? It has been shown to improve quality of life, improve engagement and satisfaction with services and supports, improve whole health, including chronic conditions like diabetes, decrease hospitalizations and inpatient days, and reduce the overall cost of services. We pulled some statistics from around the US, and these are just a few. Feel free to look. There are just some wonderful sets of data coming out on peer wellness and peer support. So you can see Recovery Innovations in Arizona saw a 56 reduction in hospital readmission rates. Pierce County, Washington reduced involuntary hospitalizations by 32%, leading to a savings of $1.99 million in 1 year. Tennessee Peer Link program had a significant decrease of 90% in average numbers of acute inpatient days per month. In Connecticut, Community for Addiction Recovery is reporting that approximately 83% of individuals maintain sobriety while receiving peer coaching services in their program. Another really cool thing about peer support is that it can work with varying different demographics, including with teens. Report from the CDC, the Youth Risk Behavior Survey, stated that several areas of adolescent health and well-being are continuing to improve overall, including risky sexual behavior and substance use. And there's also a decrease in the proportion of youth who were bullied at school through these years. Unfortunately, almost all other indicators of health and well-being in this report, including protective sexual behaviors, experiences of violence, mental health, and suicidal thoughts and behaviors, were worsening significantly. One way that Good Shepherd is offsetting this is by our Hermiston High School teen groups. This consists of weekly group counseling sessions with myself, a Hermiston High School clinical social worker associate, and in partnership with CCS. Last year, approximately 20 teens participated, with the vast majority reporting an advancement in physical health, mental health, personal relationships, ability to finish schoolwork, and overall outlook on life. And this was made possible by the Teen Mental Health Outreach Grant funded by the Good Shepherd Community Health Foundation. So to wrap up, mental health is not just the absence of mental illness. We can all strengthen our ability to combat crises when they arrive. Rural areas need greater access to care. Peer support is an effective and evidence-based practice. And Good Shepherd continues to work on improving the health of our community. I have some resources up here. This is not an extensive list whatsoever. And if you are looking for resources, the Good Shepherd Health Peer Support, you can contact me and I can get you connected to the right areas. And you can also find more information on what I shared at the CDC, mentalhealthnational.org, and peersupportworks.org. Thank you for coming and for your time.